Next. Okay, fat metabolism. Very good. Okay, detoxification. Antibacterial. Many bacteria that are taken from the intestines, sometimes they are thrown into the portal circulation. The liver tries to kill all those unwanted pathogenic bacteria. So, antibacterial, metabolism, production of hormones, production of clotting factors. What are the clotting factors that liver produces? Anybody can type. What are the clotting factors? 279, 12. Okay, 9, 10. 2, 7, 9, 10, 12. Okay, the other is vitamin K dip. 2, 7, 9, 10. Very good. Aisha. Rahim from Shada, 9, 10, 2, 7, 9, 10. Yeah, that is the right answer. So the clotting factors and production of albumin, production of proteins, production of albumin, serum albumin is produced there, and cholesterol is produced from the liver. So these are the liver functions of the liver. So the liver function, the liver anatomy, liver blood cell. How the liver just hangs, the liver is supported by a lot of ligaments. One is the, I'll come to the whiteboard. From the, this is the, this is diaphragm. From the diaphragm, we have some ligaments. From the diaphragm, we have some ligaments. And from the stomach, we have some ligaments. And from the vessels, like aorta, we have some ligaments. Aorta also, we have some ligaments. So it is suspended by these ligaments support. So in the right upper quadrant, right hypochondria. Okay, what is the dextrocardia? What is dextrocardia? Dextrocardia is heart being on the right side. Usually heart is on the left side, 2/3 on the left side, 1/3 on the right side. That is the normal position. Dextrocardia is your heart being on the right side. So what in dextrocardia, many times the liver is on the left side, the spleen is on the right side. That we call it situs inversus. And sometimes the dextrocardia may be associated with situs solitus, same right side liver, left side spleen. So these are the various locations. So when liver is enlarged, can you just show the picture, couple of pictures? Last week or two, I'll focus on the clinical aspect of especially useful for the final year exam going student. Anyway, I'm taking classes in college. We have a schedule for 1 month because you have not seen the patients for last so many months. We have designed a special program for you, my college students, where I'm going to teach for 1 month the clinical medicine different batches, all systems, especially all systems, instruments, X-rays, ECGs, everything to prepare you for your practical examination. So, yeah. You can see, right?
Yes.
Yeah, this is the liver.
Charging is not there.
This is the liver. Okay. You can see nicely here, left hepatic artery, right hepatic artery, right gastric artery. This is the celiac trunk. This is the celiac trunk. Celiac trunk giving a branch of hepatic artery, and it has got a duodenal, gastroduodenal. You all know about this. Gastroepiploic, left gastric. This is the blood supply to the liver. This is the division I was talking about. Is 8 segments. Like because each segment has one hepatic artery and portal vein. It is easy for the surgeons to resect the one each lobe. Okay. Oh, okay, I'll change this.
Want to rotate, sir?
No, it's okay. Next.
Next one.
Yeah. And this is the hepatobiliary system. You can see here, right hepatic duct, left hepatic duct. Yesterday we were talking about this. And cystic duct, gallbladder, common hepatic duct, and common bile duct, CBD, and the pancreatic duct, both are opening into the, just behind the duodenum in the C loop of the duodenum. Same thing. These are the functions of the liver. Storage, it will store iron, copper, vitamin B12, A and D, and it will also function like immune function. And as I told, this protein synthesis, coagulation factors, and transferrines, hepatoglobulins, and nutrient metabolism, carbohydrate, proteins, and lipid metabolisms also takes place in the liver. And these are the general functions of liver. And then
Done, sir.
we have some more.
Yes.
One second. Yes. Yeah. Yeah. You can see here palpation of liver. The triangular shape of dotted lines are liver borders. The upper border of liver is in the right fifth intercostal space. Here you can show this, please. In the mid-clavicular line, the upper border of liver is in the fifth intercostal space, and in the anterior axillary line, it is in the seventh intercostal space, and the posterior axillary line, it is in the ninth intercostal. The liver comes down like that. Can you focus very closely? Very close. See, in the mid-clavicular line, the upper border is in the fifth intercostal. In the anterior axillary line, the upper border is in the seventh intercostal. Posterior axillary line, it is in the ninth intercostal. That's why when you're examining your percussing, especially, you should remember these areas. So when you want to percuss the liver, come from the top, in the mid-clavicular line, above downward, start from second, third, or fourth, and then when you reach the dullness, that is the upper border of liver dullness, and below, usually you don't palpate the liver normally unless it is enlarged. You don't palpate the liver normally, but if you are able to palpate the liver, that means it is either enlarged or pushed down. So all palpable livers need not be enlarged livers. Sometimes the liver may be pushed down because of some lung pathology or some massive pleural effusion. Massive pleural effusion, the liver is pushed down. So you will palpate. So palpation liver, as we were talking yesterday, can you show the picture? This one. So this is how we have to palpate the liver. Actually, you should keep the fingers parallel to the costal margin. As I was showing you yesterday on a live patient example, the fingers, the border of your index finger should be parallel to the costal margin, and slowly right from the right iliac fossa you go up to palpate, because the liver expansion, liver enlargement is towards the right iliac fossa. So imagine every patient that it could be a massive hepatoma. Otherwise, if you start palpating somewhere here, you will miss if it is here. So that's why you have to start from the right iliac fossa, always. Especially in the examination, we'll ask you how to palpate the liver. You show on a patient, live patient. I don't know, this time the practical examination will be with patients or we don't know, virtual patient, we don't know. So this is the method of palpation. And if you're go on palpating, asking the patient to take a breath, because when you're breathing, the liver moves down with the diaphragm, you'll be able to feel the lower border of the liver. If you're not able to feel the lower border, that means liver is not enlarged. Sometimes liver may be enlarged upwards also, rarely, but usually it enlarged down because there's a resistance up because of the diaphragm and the lung presence there. So that is the thing. So when liver is palpable, that does not always mean that it's enlarged. So you have to see for any pathology in the lungs. That is the important thing. And you want to feel the tenderness. Sometimes enlarged livers, when liver is enlarged, the capsule of the liver gets stretched, and you feel that severe tenderness. So yesterday we were talking about acute cholecystitis, which will give rise to tenderness in the right hypochondrium. So liver enlargement for any reason, be it hepatitis or whatever, the stretch of the liver capsule, because liver capsule has